How do you care for your family with so much seemingly conflicting information on COVID? Today, I'm talking to our beloved Dr. Lee Rice from Life Wellness Institute about what he's seeing on the ground as a physician and how we can protect ourselves from the virus. Also, where we can look to get reliable information and how we can care for ourselves both physically and emotionally during a really stressful time.
Hey,
Hi, Dr. Rice. How are
how
you?
are you? I'm good. How are you?
Good. Thank you. Thank you for taking time to do this.
You're welcome. Thank you.
My pleasure. Yeah. What are you seeing on the ground in terms of corona? Have you had any cases personally yet?
We've had two cases of people that I know that have had it, both healthcare workers, interestingly. And it is interesting that in a couple of surveys that have been done, one hospital area, up to 35% of the people that they tested positive were hospital workers. So protecting our hospital care workers is one of the most important things, because if they start to get infected and have to be withdrawn from the pipeline to take care of people, or have to close down clinics because everybody in the clinic has been exposed, then that's a major problem. So one of the issues that we have is protecting the people that are trying to protect the people.
That makes sense. What can we do to help with that?
The main thing is not coming into the office probably without calling first and asking, is it appropriate to come, explaining what symptoms they have and why they'd like to be seen, and seeing if we can handle most of those things with telemedicine. Because it's interesting that in our practice, we've been doing telemedicine for a long time, for 20 years, basically. For most patients not in our kind of a system, they're not used to that at all. And most providers are not used to it either. And we're quite comfortable with it. We've gotten good at it. People send us cell phone messages and pictures of their sore throat or their rash, or they're examining their husband on the couch. And it's pretty comfortable for us to be able to do that. And it turns out that most things that are happening right now that really need medical care can be handled over the phone and with that kind of triaging. And very few things actually have to be handled in the office, which puts both the patient and the medical care people at risk.
Yeah. Well, when it comes to exposure, it seems like one area that's still not clarified is it airborne, droplet? Some people say 6 feet, 9 feet. You need to wear a mask, don't. Can you clarify a little bit for us just how contagious this is?
I can help to clarify that. I can't clarify it entirely. What I found is we all like to label things. We like to have definite answers, black and white. And this is a very much gray area, and there's no absolutes here. So the old thing about 6 feet was just basically based on some lab tests that showed the virus of this type in a droplet form, how far does somebody's mouth or sneeze actually express it out into the air. And it turns out most of them fall with no wind about 6 feet. And then in one European study, they had a rule, they called it the 3-meter rule. They widened it to 9 feet just to be a little bit extra safe. Recently, research was done looking at data, why people got it, how they got it, and how they became infected in the first place. And what they found was that they were infected in ways that were not anticipated. In other words, they thought to be infected, you had to have close contact, usually for prolonged periods of time. Taking care of somebody, closed in a small room with them, having a long conversation with them, in a meeting room, that kind of thing. What they found was actually that wasn't quite true. Many people were getting infected with no significant exposure with known people that had the disease, other than walking by them or being in reasonable proximity to them for very short periods of time. Then they thought, well, maybe we were wrong. Maybe it's not just droplet contamination. Maybe it is aerosolized contamination. And aerosolized means very small water particles that can be expressed out into the air. And typically, if you've ever seen a video of a cough in a room in a dark lighted thing, you can see that the cough in seconds goes throughout the whole room. If you've seen somebody smoke and you've walked by a smoker smoking a cigarette, and that vapor, you can smell it for 15, 20 feet away, especially if the wind is coming your way and you're downwind, right? So what we know really is that there can be viral particles that can be expressed. It's been measured now as far away as, I think, 27 feet from the person that has it. And that's not necessarily counting wind and atmospheric conditions. There's a guy who did some studies at the surf line looking at how surfers can get exposed to different viral things like that. And he found that it was quite much further than we thought. It's not the 6 feet. The other question is, how much virus do you have to get exposed to become infected? And again, if you're within 6 feet and you get that viral droplet, then you get a bigger viral load. And the bigger viral load you're exposed to, the greater chance that that amount of virus can cause an infection. But if you're 10 feet away and you get exposed to an aerosolized spread, you still get exposed to virus, not that much of a virus in terms of amount, and therefore the chances of it causing an active infection in your body and your body not being able to fight that off without becoming infected, without becoming sick, it looks like basically it's less of a chance. But it's still not black-white. 6 feet, you're okay. 5 feet, 11 inches, you're not. 6 feet 2, you're totally protected. It's not that thing at all. So I think the more we can stay away, at least 6 feet, but the broader the range we have, the more safe we are.
So what is your current recommendation to people?
To stay away from other people, to basically stay in your home unless you're in an essential sort of a business. If you have to go to the store, go at a time when there's the fewest people there. Anytime you're around a group of people out in public where other people are coming around or you're passing by and you can't really control the situation, I think you're better off wearing a mask. Mm-hmm. And it doesn't have to be a medical grade mask, or you hear about these N95 masks. It doesn't have to be that. Any kind of protection over your mouth and nose will give you some protection that's useful. It's not 100%, but it's better than not covering. And it's been truly shown that these, N95 masks and all that, in most circumstances, they're not tremendously more protective than anything that keeps your saliva and spit and aerosolized vapor from just spreading out into the area. So when people are around other people, unless they're close family members that they know have been quarantined with them, then they ought to be protected by a mask.
That brings up a great point. So there are a lot of people with elderly relatives who may even be isolated right now.
Sure.
Meaning that they're isolating alone. Do you have guidance for how we care for them while taking maximum protection?
I do have some thoughts about that. I've seen that close up. I've got a patient whose wife passed away a number of months ago, and his only joy right now is really being with his grandchildren. And now he's been told that he really shouldn't see his grandchildren. So psychologically and socially, that could be a big problem. However, what we're finding is this. In San Diego County is a good example. There hasn't been one child under the age of 10 years old that's been diagnosed with COVID positive. No child under 10 has been hospitalized with this. That doesn't mean, though, that they don't get and pass potentially the virus along. Children tend to play together. It's hard to keep children adhering to that 6 foot or 3 meter rule, right? So when kids get playing with other kids who have been with their parents and their extraneous friends or whatever, it's very hard to make sure that they've been isolated for the last 14 days and may not bring in infectivity to an elderly person. Mm-hmm. So we're advising people that are over the age of probably 70 to stay away from their grandchildren unless their grandchildren have been totally isolated also for at least 14 days and they know that they're safe. Otherwise, it's just a bigger risk because the people that get this that are over 70, especially over 80, are the ones who tend to get the most serious consequences from being sick.
That brings up a good point because I've heard a lot of we hear a lot of conflicting information, even from reputable authorities. So I've heard 2 days, I've heard 14 days. Where do you recommend that we look for our sources of information as this is evolving?
I think that the best sources are the CDC website, the WHO website, Johns Hopkins coronavirus website. All those. Johns Hopkins keeps all the data. CDC has the latest WHO recommendations and the latest countrywide and nationwide data. And actually, San Diego, if you Google San Diego Health and Human Services coronavirus, you'll pull up all the local San Diego data. And that I think they have also a link for California data. California government coronavirus, california.gov coronavirus. Those are the ones that are the most up to date, the most legitimate, and the least kind of laden with misinformation.
Mm-hmm. Yeah, there's a lot of sensationalizing also.
Sure.
For good reason. People are very scared. What is your level of concern right now?
I have a very high level of concern, not a high level of being scared. I don't think we need to be afraid. This is the good news. Sort of unlike cancer, you may just get cancer and there may not be too many things you can do if you do get it to be in the lucky group that responds to therapy. With this kind of a thing, we have control over this if we're just willing to pay the price of social isolation. If we just stay away from other people, as we've been advised, if we wear masks when we go into places that are public, like the market, if we don't touch things, we should clean our hands before we go into a public place and immediately after we leave, and we should not touch our face or get our hands around our face. If we abide by those rules, we're going to be pretty safe and we don't have to get this. The cases tend to be clustered cases in very close contact places of living, like nursing homes, like a ship. You've seen these clusters that have happened in places, but if we stay basically socially isolated, pay attention to the hand and mouth hygiene, wear masks when appropriate, we're pretty safe. And if you look at the last couple of days in San Diego, they don't have it published yet for yesterday. I think they published it sometime between noon and 3 o'clock. But the 3 days preceding that, we've almost leveled off the new cases in San Diego. And if the published numbers of cases today turn out to be about the same as yesterday and the day before, that's a very good sign that the social distancing is actually starting to level off and hopefully eventually will decline. I'll say one other thing, herd immunity. You've heard that term probably. As more and more people become infected, there will be more and more people that have some natural resistance. And that's a very positive kind of a thing. The latest information tells us that up to 30% of people who actually have coronavirus would test negative for it, given the current testing efficiencies. It could be not exactly the right kind of methodology to take the test, something wrong with the test kit itself, the reagents, something wrong with the way it was performed. But we know that this is not 100% in terms of accuracy. So there are false positives and false negatives, more false negatives. So I just had a case, another doctor that I know actually was tested negative because he had symptoms that were typical of coronavirus, tested negative by the county, and 2 days ago got an antibody test, and he's actually had it for about 3 weeks. He's been isolated that whole time, so he's put nobody in any danger. But the point is, a lot of people may think that they don't have it. They think they have the flu or a common cold because it's very mild. 80% of people, 80% plus, who get this will have mild or minimal or even no symptoms whatsoever. And so just because we think we're fine doesn't mean that we're not being able to pass it around. And there are a lot of people that have had this probably and are getting over it who don't even appreciate the fact for sure that they've had it.
Yeah.
Because we've not been able to do testing very widely.
Well, that is an empowering message that if we are willing to be disciplined enough, that we have a great deal of, what's the word? Self-determination?
Self-control, yeah, self-determination,
yeah,
commitment, awareness of social responsibility.
Mm-hmm. Yeah. You mentioned the situation by contrast where you get a cancer diagnosis and there's not as much you can do to directly affect your likelihood of getting sick. As a physician who sees people in that kind of uncertainty where they've just gotten a diagnosis like that, I see some parallels to right now where there's a lot of anxiety and uncertainty and fear. Are there any lessons from having those experiences with patients and walking with them through it that you could share that might be applicable to us today in the climate that we're in?
Well, I think that the main thing to understand is that most people who get this are going to do just fine. It's going to affect them no more than the common cold or rhinovirus or the flu. They're going to deal with it fine. It's going to last for a number of days, 7 days to 14 days. They're going to gradually get over it and they'll be just great. It's the people that have very specific symptoms, primarily of respiratory distress. They're the ones that need to go to the hospital. And the sooner they get there to get that help, the better chance they have of surviving it. The treatment for this, the only treatment so far that's been shown to be effective for people that are seriously ill with it, is a ventilator. And so timing of getting into the hospital and getting on a ventilator can save people's lives very much. There are certainly studies that have shown pretty clearly that the people in greatest risk for this are those that have secondary diseases. They've got comorbidities. They have obesity, they have diabetes, they have heart disease, they have hypertension, they have pulmonary disease. The people that have those things should really protect themselves by staying isolated and staying away from other people that they are not sure have also been isolated. And if they protect themselves, they will not get this either. Mm-hmm. I think the main thing for people at higher risk is just to be sure to isolate and pay attention to all those rules. And if they do those things well, the chances of them getting infected will be much, much less.
Yeah. You mentioned the herd immunity, and I heard something, there was a kind of popular video going around by a Cornell doctor, and he said with each year that this virus will become weaker. And I wondered if that means the actual virus if it's my first time getting this is next year, will that be a weaker strain, or will it just pass around? It'll be just as severe for me as it would have this time, but fewer of us will get it because more of us are already immune.
Well, again, these are theoretical decisions and statements that people will make because we have had no history with this particular virus ever before. So nobody can say what's going to happen for sure. Mm-hmm. What we can do is say, there are other types of coronaviruses, not this one. This is a novel one. But other types of coronaviruses and flu bugs have had a similar pattern over the years. And that is the longer they are around in the population, the more they come around the next year and the next year, the more herd immunity there is. We all have some resistance, maybe if not exactly to that virus, maybe to viruses like it. And so there's some cross protection that we may develop. And so, yes, eventually it has less of an impact in terms of severity and infectivity. This virus has shown not to mutate quite as quickly as the typical flu. And so the hope is that when they finally develop a vaccine for this one that works, it won't have to be redone, the vaccine, like it does for the flu bug every year. It won't have to be redone every single year because the mutation rate has not been that quick. So once they get a vaccine, hopefully it'll be more effective for a number of years and be more effective. As you know, sometimes the flu vaccine is about 50-50. Mm-hmm. We're hoping this one will be much better for longer.
Yeah, that is certainly hopeful.
Yeah.
What are some of the questions that your patients are asking that you would like us to know the answers to?
Well, one of the most significant ones probably is, when am I infected? If I've got a sniffle, am I going to give this to somebody else? And one of the most significant recent impacts that we've seen in terms of the literature is having to do with when do I actually have the ability to infect other people once I have the virus myself. And it seems to be that the most infective time, the time when you're most infective, is the 2 days before I start having symptoms. So it's 24 to 48 hours before you start feeling sick. That's when you can spread it the easiest. Mm-hmm. And so that's why we have to socially isolate. There's two things that concern me. One is we don't have adequate testing, so it's not possible just for everybody to go down to the corner and get tested. And for about 14 days, you can have this disease, pass it around, and not even know it. So the fact that there's so much unknown about who has it, and we can't get tested right now on a broad scale basis to find out who has it, that's why this social isolation has to be so important, because just feeling fine and only hanging out with people that also feel fine is not protection. It's
Yeah.
not. Social isolation is the protection. That's what we have.
When we talk about not knowing who has it and having to, let's say, get groceries, we've all seen videos where there's the clean side of the counter, the dirty side, extensive washing, alcohol swabs. How careful do we need to be? Because it's hard to know.
It is hard to know. I think the more careful, if you look at those videos, there's some good information there. However, I had to chuckle at one of them I saw, and he was picking up the bag and putting it over here and thought that was safe because he put it on the good side, but he grabbed it with his hand when he did that. So the top of the bag was still, potentially infected. The more we can, in general, keep numbers of hands away from our food and the food sources and bag handlers and packagers and so forth away from it, the better we are. I think the more once we get food home, we can separate it and keep it safe. I think that's fine. I'm not sure how much difference it makes, how many bags we put it in and which side of the counter we put it on. I think the key thing is frequently, if you have things from outside placed on countertops, placed on kitchen sinks, that kind of thing, frequently wiping those surfaces off to keep them as clean as we can, washing our hands after we handle the food and so forth. Again, wash our hands, sanitize our hands, make sure that's not the case. Keep your hands away from your face while you're doing all that. I think we're going to be most protected just by paying attention to those basic things. Common sense about handling food. There's no magic, I think. I don't think you have to put it in the autoclave at home and sterilize it.
Yeah, that's good to hear. What should we do if we think we have COVID-19?
If you think you have COVID-19, I'm assuming what you mean is you feel sick in some significant way with probably a sore throat or fever or cough or shortness of breath. If you have any of those things, that is significant. I recommend you call your doctor and ask your doctor what to do. If it's just the typical cold symptoms that you have with an early flu or just a scratchy sore throat or mild congestion, there's no sense calling your doctor because your doctor can't do anything for that except to advise you to take over-the-counter medication and rest and have fluids and get plenty of sleep. The best thing you can do if you start to get any infection, including this one, is to balance your own immune system as well as you possibly can. Mm-hmm. So that means regular sleep, at least 7 to 8 hours sleep a night for most people. It means eating well, not missing meals, but eating normal-sized portions, not stuffing yourself. Minimizing, obviously, anything other than whole food. So that includes alcohol, tobacco, caffeine, any drugs, none of that stuff. Thinking positively. I'm convinced that positive attitudes, being relaxed, not being afraid, those things maximize our immune response. If we get all amped up about this and fearful, we'd actually create less immunity because we're creating more inflammation in our bodies by our attitudes. Yeah. So I think having a positive attitude, controlling the things that you can control, moderating the health-related behaviors in your life like sleep and food and motion, continuing to move, not just staying isolated on a couch, relationships, maintaining positive relationships, and maintaining a good attitude of gratitude, attitude of forgiveness, attitude of comfort in what you can do and be blessed for what you have right now. That's just so great that many people don't have. That's, I think, critical for all this.
Absolutely. Those are great habits to take with us from this experience in the future too.
I think that there are some great lessons that will be learned from this. Lessons about how wonderful it is sometimes to be home alone, to be with the people that you love, to open your hearts to them, to reach out to people. I've had calls and emails and messages, as I'm sure most of us have, from friends that we haven't talked to in a long time, just because we're reaching out now because relationships mean more and we have more time to think about it.
Yeah.
That's pretty good. That's a nice little secondary effect of this.
Yes, it's a beautiful silver lining. And I love the way people are caring for one another in very creative ways.
Mm-hmm. Yeah, very much so.
Is there anything else that we haven't talked about that maybe is a question you field a lot that you would like to make sure that we share?
Well, maybe one thing would be just keep following the websites we talked about regarding the true data about what's true and what's not true. Everybody that is thinking of anything, I heard yesterday, I got an email from somebody that wanted to know if it was true that if you turned your hair dryer on high and held it up to your nose, that, 3 times or 4 times a day, that you're preventing this virus from taking hold because it responds poorly to heat. There's all kinds of crazy ideas out there. Stick with the basic, those websites that we talked about that give you legitimate advice. There are in the last week, over 30 new trials have been started looking at drugs to either prevent the infection, to be helpful with other drugs once you have an infection, or to be treatment drugs once you have the infection. And we don't know which ones of these may turn out to be true. There's a lot of people asking their doctors and going to their pharmacies and trying to get prophylactic meds that have not been proven. Those have some side effect dangers potentially. So I think rather than try and panic and hoard drugs and try different things that you don't know work and your physician is not advising, just trust the medical system that first of all, have a relationship with the medical system, somebody that you can trust and care about and who will answer your questions. But trust them to look this up and scientifically evaluate it and tell you whether it's accurate information or not. But don't start trying things because you read it, somewhere in People magazine or something, because most of those things are worth just the paper to blow them up.
Yeah. One of the things I think is tricky about this is we're in uncertainty, and it's for an indefinite period of time. We don't know if it's a month, 2 months, next, 9 months from now. From an emotional health point of view, do you have any strategies for how we might stay positive given the kind of disruption to our lives right now?
Yeah, first, I guess, assume, like everything else in life so far, this will pass. This is a temporary thing. We're having a giant inflection right now for how big it's impacting us and the number of people that are impacted and the financial overtones of it. This is huge right now. But this kind of a crisis at this level is not going to last forever. We're going to get over it. It's going to be okay in the end. So I think the first thing is to see that big picture that this too shall pass. It's not forever. And we have hope that things are going to be figured out. There will be a vaccine. There will be some treatments discovered. There will be the lessened need to socially isolate. And we'll have our life back again eventually. It may never be exactly like it is now, but some of that may be good, some not so friendly and helpful. So the first thing is that big picture, have confidence and patience that if we do the right thing, we'll get through this as quickly as we can with the least amount of damage. And in the end, if we've paid the price we need to succeed, things could actually be better in a lot of ways because we'll now be way more protected because the government and other officials, private enterprise is way more attuned to the potential dangers of something like this happening again. We're going to be much better prepared. The other thing I would say is that as we tell people in addiction, just take one day at a time. We can't control tomorrow. We don't know what the data tomorrow is going to show. I was in a conversation yesterday with a guy who's the head of medical care. He's the medical director, basically, for Major League Baseball. And they're trying to do what to do about the year. Do they salvage the year? Are they able to get it going? How long do they put it off? When can they start their training camps? And he was saying he was in a meeting, and they meet every day. He says he spends most of his time now, 2 or 3 hours a day, in meetings with owners and other people trying to figure this all out. He said the problem is the data changes so quickly that we have to keep up on it. We have to change our decisions halfway through. And he said sometimes we'll be in a meeting for 2 hours. We've just looked at all the world's data. We've come upon a conclusion and a solution and an action plan. And by the time the meeting's over, the data has changed. And we have to blow all that up and start all over again. Mm-hmm. So there's a lot of things we can't control. All we can control is we can keep our eyes peeled, looking at the data, make the best decisions at the time based on the hard data that we have, and take care of what we can do today. And let tomorrow take care of itself. So if we just stay in the moment now and just control what we can control today based on the information we have, and trust that tomorrow we'll make the best decisions we can make for tomorrow, We don't have to know the total outcome or the whole game plan for the next 3 months because we can't.
Yeah, that's so much more manageable.
Yeah, it really is. Just handle the things that you can handle and let go of the things that you can't control.
Yeah. Well, Dr. Rice, thank you for taking care of your patients and for sharing with us. And thank you for the work that you're doing,
You're welcome.
on the front lines, really.
We all have our role to play in life, and it's my pleasure and privilege to be able to play this one right now. So it's fascinating as a medical practitioner and a clinical scientist of sorts. It's a fascinating event to look at from a medical perspective because we're learning things we never knew before. And it's opening our eyes and educating us up a lot about things that we didn't know were true. And it's helping us be better clinicians and better educators and better helps to our patients. So thanks for the privilege.
Dr. Rice, thank you so much for talking with us today.
Thanks, Lisa. It's always good talking to you.
Thank you.